Welcome. I'm Dr. Liana Leonov, and welcome to this Lifestyle Medicine podcast series for the RCSI University of Medicine and Health Sciences. And today's topic is stress and stress management. And I'm delighted to have with us Dr. Prachi Garodia. She is the whole health clinician, clinical director for the VA administration in Miami, Florida. And most importantly, she has this passion for healing the world. Welcome, Prachi.
Thank you so much, Liana. It's such a pleasure and honor to be here and reaching out to our friends in Ireland and hopefully all across the world.
Yes, we're going to share this across the world. And this is a topic that's of strong interest to all of us because all of us in day-to-day living face one level or another of stress. So very important to dive in and learn more about it and what we can do about it. So let's start with, what is the impact of what we would call high stress on our health?
Thank you. That's such an important question. And we all know in modern day time and living, it's such a high pressure environment, day-to-day living, and then chronic, it builds up. So sometimes even short-term stress is actually good because it motivates you to move ahead and do things. But if it's the same thing over and over, day in and day out, then it becomes a problem. So there's significant negative impacts on both the physical and mental well-being, including cardiovascular health. So for example, because the chronic stress really activates and stimulates cortisol, which is a stress hormone production, and really misaligns the HPA, which is the hypothalamic pituitary axis, which controls all our hormones from the hypothalamus, the controlling site in the brain, to the pituitary, to the, adrenal glands, and all of those. The function of the hormones really gets disrupted. High cortisol also impacts a lot of the physiological phenomena like narrowing the arteries, creating plaques, increasing sugar levels, and thinning your bones. It's a lot of issues, creating gastric ulcers. It's a lot of impact on cardiovascular health, immune functioning. So it has been researched and found out that prolonged stress weakens the immune system, making people more susceptible to infections, chronic inflammation, illnesses, even autoimmune diseases.
Yeah.
So it really, really is very important. And similarly, I had briefly mentioned the digestive system. So things like irritable bowel syndrome is highly associated with high stress living, in which, people might have bowel movement dysregulation with alternate diarrhea or constipation, or chronic constipation or chronic loose stools, which is very intrusive to social life. Similarly, that can also progress and lead to inflammatory bowel disease and even autoimmune disorder. And we already talked about stress ulcers, and that's what is caused by high cortisol. Similarly, mental health is impacted with high and chronic stress. So impaired cognitive function, that means impaired memory and concentration, decision-making abilities, all of those are affected because of living under chronic stress. And then sleep disturbances, it also messes up your hormone for eating. And so you have more cravings, especially for high fatty and high sugary foods, which can result in weight gain and obesity. And as a result, there'll be a lot more problems coming in. Cortisol also promotes fat storage, especially around the abdomen, giving rise to the apple shape compared to the pear-shaped, structure of the body. Then skin is also very affected. So for example, flare-up of acne, eczema, psoriasis, all of those things can happen because of high stress. And you might have known or noticed that whenever there is stress in life and people do have those kind of skin disorders, they definitely flare up acutely. So your body can, your mental stress can be reflected on the skin. And lastly, but not the least, reproductive health is significantly affected. A lot of fertility issues, decreased libido, irregular menstrual cycles, and both, decreased libido in both men and women, and fertility issues in both sexes. And pregnancy outcomes can be impacted. It's a lot of impact on, well-being.
Just goes to show, that's a beautiful summary of how high stress impacts every system in our bodies, every part of our bodies. And so the negative effects of high stress can be very disconcerting. And yet so many of us, that's how we end up with so many of our physical health problems, mental health problems, is because of ongoing, especially the ongoing chronic stress. And so then, of course, the natural question is, well, what does the science show about how we can best decrease at least the effects on our bodies from stress? We're not going to be able to get rid of stress altogether. So how do we then manage ourselves so that we remain as healthy as possible despite all the stressors that life throws at us?
Yeah, thank you for asking that question. It's very, very important to find out, how can we minimize the impact? And science, there's a lot of research and science studies done on this. And there are various uh, tools and, options to follow, different techniques which have been studied in deep detail. And all of it boils down to what the individual preference and circumstances might be. For example, some people might prefer doing mindfulness meditation. Some people who are more tuned into the body, they might want to do some progressive muscle relaxation or deep breathing exercises. Some people might want to do mindful movement practices, which include a lot of movement and breath work and gentle rhythmic moving of the body, like yoga and Tai Chi. And then regular physical activity like walking, jogging, swimming, gardening, being in nature, just being on a hike with friends and connecting, that really helps too. So these are some of the tools and interventions which have been studied and have shown great results. And again, because these are individualized to people and to groups when they're doing studies, there are different reports and outcomes out of those. For treatment purposes like CBT, which is cognitive behavioral therapy, that's a psychotherapy program which works on helping individuals identify and change negative thought patterns and behaviors. That has also shown really good beneficial effects.
Yes.
And basically learning coping skills, relaxation techniques, whatever speaks to you. Like simple things like gratitude practice have been shown to improve resilience and really improve happiness in your life, which really mitigates the impacts of stress and makes you feel much more fuller and more thankful for little things in your life.
Yeah, and thank you for that, Prachi, because as an advocate for positive psychology strategies in our health and well-being, one way we can help our stress is to use some of these positive psychology tools that you just mentioned. And not only that, but even just simple things that we can do in the moment, which is to stop and reframe a particular thought, like you were saying, that the negative thoughts, step back and say is another way to look at the situation, which will help calm us, as well as just to have some self-compassion, give ourselves a big hug, and then gently see if we can redirect ourselves to look at things that are going well in our lives, and despite maybe the craziness all around us, and just that refocusing can make a big difference.
Totally, yeah. And people can practice, I mean, the mindfulness practices, you can just focus on your breath, you can focus on an object outside of you, you can pick up a stone or a favorite, you know, a item with you and keep it with you, or you can do like a mantra meditation, which is just repeating a word or a phrase which has some meaning to you. And these are the focuses which will sort of divert the attention away and will pacify the sympathetic activated system, the nervous system, which is in the fight and flight mode, and shift it very gradually and smoothly to the rest and digest parasympathetic mode. And that, if you do it often, so consistent practice is the key. If you do a practice for like 5 minutes once a week, it's going to impact you for that day for a few hours, a few minutes, or whatever, depending on how, focused or defocused you were. But if you do just for 2 minutes or maybe a minute practice several times daily, little drops will fill up that bottle really fast. So the balance is going to tip much more permanently in a more positive manner.
Yeah, absolutely. And so we've been talking about some very practical tips and approaches to help manage our stress. Are there any others you can think of that are just easy ways to help ourselves in day-to-day life?
Sure. I just have some like little tips. Obviously, consistent practice, we already mentioned. We talked about starting small is really important. So when we talk about like SMART goals, it has to be specific, and you can try any of those tools. You can try multiple things and see what really speaks to you, what you really connect with. And you can do two or three of those. There's no like, you don't have to just stick to one.
Yeah.
You can try it for like 1 week, and then next week you can try another practice. So, but starting small is important so it's not overwhelming. And sometimes habit stacking, like if you're already doing a good lifestyle practice or something regularly, like you're eating your breakfast at this time or you're taking a walk, just making that determination, I'm going to stack it. To stack the new habit with either brushing my teeth or tying my shoes when I go for a walk, just sit down, be grateful for like three things I'm grateful for, or maybe take like 5 deep breaths, and that could be your mini practice. And finding out what works for you in the long term. And I personally obviously do a step like a multiple of those. In the morning, I do breath practice and a brief body scan. During the daytime, I try to focus on maintaining, a good posture and movement and breath practice. And then at nighttime, I do like a yoga nidra, which is the yogic sleep practice, more like a progressive muscle relaxation. And then sometimes I listen to really calming music towards the evening. I do, so a lot of these practices can stack up to shift that balance. And then practicing self-compassion, like you said. So maybe, accessing some scripts online. There's a lot of YouTube videos and scripts which you can read for yourself or have your family member read for you, especially during time of stress. So self-compassion when you're judging yourself. So that's something. And then seeking support when it's needed, like professional help or even friends and family, reaching out to them and sharing if there's a difficult or challenging time you're going through, just reaching out and connecting and sharing the human, emotions together if there's somebody to support you. One
Yeah.
practice which I really has changed my life is the gratitude practice.
Wonderful. You covered so much ground, and it's not then a surprise that you project so much calm, Prachi, because you're integrating so many of these practices into your daily life. So you're a great example for us. So thank you for being a role model for us. Is there a key message around managing stress that you would really like to impart to our listeners?
Yeah, one of the key message is just be gentle and kind to yourself and treat yourself like your best friend. We are so loving and kind to our best friends and we sort of treat them like more like a porcelain person. And for us, we just beat ourselves. So whatever practices you plan to do for your own stress management, I would recommend turning that love and compassion also towards yourself. And that's the best healer, just finding the love for everybody, including yourself in your heart.
Starts with that self-love and then figuring out what works best for you. Yes,
Totally.
yes. So as we close, anything else around stress management that we haven't covered that you think is important to highlight?
I think, well, being out in nature is so healing too. And especially if you can get out in nature with friends or even your pet and just admire the beautiful gifts of Mother Nature, the flora, the fauna, the beautiful sky, the wind, engaging your senses and really, really feeling nourished. So really, really helpful. So there's actually treatments for forest bathing and forest therapy, which has been started in Japan and got really popular.
Yeah, nature walks are my favorite way to de-stress. So that's it's great that we're closing this short lifestyle medicine podcast with that, with one of my favorite tools. Well, thank you so much, Dr. Prachi Garodia, for joining us on the segment on stress management, and thank you to our listeners to this lifestyle medicine podcast series. And we hope to see you on another one of these segments soon. Take care, everybody. Bye-bye.